Hello, welcome back to the Care and Conversation studio, live from the Care Show at the NEC in Birmingham. That's a really long sentence, that is, actually. I've been saying that all morning. It's very long. I keep almost saying London, the XL in London, because that was the last one we did.
Easy mistake.
So, we're here with Alex. How are you, Alex?
Yeah, very good, thank you. Very
Perfect.
busy day.
Busy day. Right, do you want to tell us who you are and what you do?
Yeah, I'm Alex Ball. I'm the operations manager at Stowe Healthcare Group. We are a family-owned and run business in East Anglia. We take over failed care homes and turn them around. So I'm ops manager there, so that's kind of overseeing the day-to-day operations and kind of working on turnaround projects and other things, including workforce.
Perfect. So, yeah, future of workforce. I mean, it's an open question. What does that mean for you, future of workforce?
I think it's about future-proofing the workforce and making sure that we've got people coming through right from the bottom and coming up to the top as future leaders for the sector. My background, so I didn't set out necessarily to work in social care and kind of fell into it and started working part-time as a kitchen assistant and have progressed from there. So have done different roles within the home setting and then moved into the group provider role and management eventually. So what I do in part of my job is use my own story to inspire others to look at different routes and career pathways within the sector.
Perfect. So I guess a lot of it is when people join the care sector is explaining that actually there is quite a really good career path for you to follow here. So what was your path again? What did you say?
So I started as a kitchen assistant,
yeah.
So did that and domestics, and I think that's what we're trying to say to people is you don't necessarily have to come into care and do the job that you apply for forever. It's coming through the door, finding what is right for you. Is it in the kitchen or is it as a cleaner? You're not that confident in, you learn a lot of communication skills in the work that we do, interacting with people, but you might not have the confidence to deliver personal care. But that's a great set of skills for a domestic who can go in and have those chats that they've got the time to have those personal conversations. So it's those kind of roles, they don't understand how many life skills they're learning on those kind of jobs.
So in terms of kind of like through COVID, obviously there was an influx of different ages of workforce, different backgrounds of workforce. What's the current trends at the moment? Like, what type of people are coming in? Are you recruiting like mainly economically inactive people? Are you recruiting young people? What's the sort of mix for you at the moment?
We've got a bit of a mixture across our organisation, and what we try and do is work with local schools and colleges and almost get cohorts of people in every year, because we're struggling as a sector, but we have got people that are going to schools, coming of age, looking for jobs, and that happens year on year. So we need to kind of be a bit savvier at filtering those people in and drawing people in. So we go and speak to people who are studying health and social care. They come through to us and we can give them some work experience based around the subject that they're studying. So they've got something on their CV, and then they can stay with us during the holidays, pick up part-time work, and then work full-time. Some come and fill that gap in the summer when our full-time staff, it's the kids' holidays and they want that time off. So it's a kind of finding that clever balance of where can you find the people to plug your gaps. So that's kind of what I work on.
I guess that's quite, for something so simple, it's quite innovative to actually just kind of go to the local schools and colleges and say...
And particularly with nurses. We've been to the local university. We spoke in March to students graduating in the summer, and 70% of those students didn't have jobs to go to.
Yeah.
Now, we're crying out as a sector for nurses, so why are we not being cleverer and pulling those people in? And from that conversation, we had 2 preceptee nurses join our company, and they're now kind of starting their nursing career in social care, and just partnering with them and offering placements. The universities are crying out for student placements, and people won't do it because they think it's a lot of hassle. You get funding for student placements, so
always love a bit of funding.
That's winner. You get funding for taking that on. One of our homes has kind of said we're going to take student placements, and we want to use our funding for that on additional tech to support our students going forward. So you get funding, they get the experience of social care, and actually you're not in a hospital setting. You can't just page the GP and get them to come down and see it. You have got the autonomy as the nurse in a nursing home, and people think you lose your skills, but you're actually developing more skills and more. You get to know the patients longer. You kind of get into the real nitty gritty of the nursing care in social care.
I guess if you work in a hospital, a lot of the care can be quite short term. You have a very strict set of kind of things that you need to do, whereas actually within a care setting that might be much broader, and then you can work with people for months and months on end.
And those student places have also cemented full-time employment for us as well. So students that thought they knew they wanted to go one way have actually said, I really like it here, and the team have made me feel really welcome and I fit in, and this is where I want to start my career. So again, it's about taking those opportunities and looking at what it's going to do for your business.
And I imagine it's fairly competitive in terms of salary, like nurses.
We pay our nurse, so we don't have a banding for our nurses. We pay our precepting nurses as registered nurses as soon as they graduate with us. We've got a full precepty program, and we've got clinical leaders who sit with them and take them through their preceptorship, and then on to where they want to go. One of our now home managers, she was a carer. She did her nursing, she came back, she did her preceptorship with us. She worked as a nurse for 2 years. She then became the deputy manager during the pandemic, and 4 months ago she was offered the role as home manager of the home she was once a carer.
Nice.
And she's now a registered nurse. So the route is endless if you want that.
Yeah. And in terms of those new people coming into the sector, so the kids that you're bringing in from the schools, are they different from the previous generation? Are they kids different from 5 years ago, 10 years ago, in your experience?
They want progression. If you look at the characteristics of Gen Z, they want progression quickly, and we have to be reactive to that and look at a pathway for them. And I'm working with the Department of Health and Social Care on the early adopters for the new workforce pathway, to clearly set out to people where you can start, what you go on to, and how you can add those building blocks to your career. And we need to have that set out, because that's what people want. They want to learn, they will absorb it, and they will run with it, but you have to show them the right direction so they're not running off in the right direction. But they grew up with technology as part of what they do, and we are developing every day as a sector in terms of what we can do with technology. So it's about how we can harness their skills and bring that in.
And I think the care sector, I've seen examples of people working in the sector for sort of 8 to 10 years, and then they're managing homes. And these are big businesses, and it's a lot of home managers. It's a well-paid role, stressful, but all well-paid roles are generally stressful. So really spelling that out to the younger ones is important, I think.
Yeah, and they love, there's a lot about sustainability and health and well-being, and it's something that we need to do better at as a sector. So hopefully they can teach us some of that stuff. How can we better manage that stress, and bringing in someone that's kind of, it's not about putting tools down and everybody going home and that kind of thing. We can't do that because we're a 24/7 service. But what little things can we do to help relieve pressure, and seeing these as opportunities to learn from the younger generation about perhaps how we can change the way we do things, and that we don't have to have that set in stone.
Yeah. Have you got a kind of top tip for people when they're recruiting? What's something that works for you guys?
I would say number one, kind of don't set that person, just get people through your doors and find their place once they're through the door. Don't assume that the role that they're recruited to is the right role, but it doesn't mean they haven't got a role with you. But get to know that person and their strengths and weaknesses. You can ask all the questions at interview, but you only really know when somebody's in and they're started working what they're like. So give people a chance and get them to find their fit and help them find their fit. And the other one really is to take those opportunities up. Be the provider that approaches your local schools, universities. Don't sit back and wait. Don't go to the careers fairs and wait for students to walk past and come to your stand, because they won't. Get face time with them, sell yourself to them, and the rewards will come back to you.
I'm sure if you approached a local high school and said, can I do a 5-minute talk in your assembly,
Yeah.
They'd absolutely let you do that,
And that's
right?
absolutely what we did, and we got FaceTime with people in their lessons as part of what we
perfect.
did, because they're covering things in the curriculum and they have to cover it, and we are doing it every day. They didn't know how to cover when people aren't compliant with infection control measures, and we were just this is bread and butter to our dementia homes, where during the pandemic people wouldn't isolate. So it's how do you manage people with COVID in a dementia setting during an outbreak. So it was really interesting for them to talk and hear firsthand how what they're learning through textbooks happens in reality.
Perfect. Right. Anything else you want to share?
No, I think we've covered everything.
Well, thank you very much for coming to the studio, and we will be back shortly with another interview.